Hello, I'm Dr. Herman, and this is a great patient coming down to my clinic right now in South Florida from Wisconsin. It's nice and warm here, where it's pretty chilly up there, right?
Yes.
And you had found me on YouTube through my
Yes.
videos? Yeah.
Mhm.
Okay. One of your conditions that you came here for was because of an emotional situation with depression. Another situation or another health concern you had was with chronic fatigue, right?
Right.
How long did you deal with depression for?
Uh, 14, 15 years.
Okay, and how long with the chronic fatigue?
Uh, Probably got bad about 5 years ago when I started changing my diet and started detoxing, and I started facing some health challenges with fatigue and brain fog.
And how long did the brain fog? 4 years or so, you're saying?
Yeah,
brain fog?
really bad.
Okay. All right. And your depression, if we can rate it, if there is a way, and I mean no harm or disrespect with anybody else out there who's also feeling an emotional state like depression right now, so we don't take this as in any way lighthearted at all. It's very serious. If we can rate your depression, if there is a way to do that, from 0 to 10, if 10 would be the worst kind of emotional state, and 0 means there's no depression, could you rate that?
I would rate it a 7.
Okay. And was it for the whole 14 or 15 years at that 7?
I would say it peaked at 10,
Mhm.
maybe came down to 7.
Were there any other treatments that you did before this?
I saw a psychiatrist, I saw a therapist, a counselor, because my doctor was concerned about me. And she wanted to put me on medication, which I did not want to start taking.
Mhm.
I saw that therapist for about 4 months.
More for discussion, speaking, counseling
Yes.
type of things, but no meds. And did that help you?
It did, because
Mhm.
she was, verbally supportive and had some positive things to say to get me to think more positively. But when I walked out of treatment, I went back to the same.
Same pattern.
Yeah.
And did your pattern ever get bad enough where you thought of actually hurting yourself?
Yes, often.
Pretty often. Huh?
Mhm.
Hurting yourself where it was like to not exist anymore.
Yes.
Kind of hurting.
Yes.
Yeah. And your chronic fatigue, on a scale of 0 to 10, if 10 was the worst with the fatigue, what was it before we started care?
7.
7? Was that
Between
an
a 5
average?
and a 7, depending on.
Okay.
Mhm.
And the brain fog, 0 to 10, if 10 is the worst?
I would say between 5 and 7.
5 and 7. And is the brain fog still there to any degree at all now?
No.
Not at all. 0.
Mhm.
So from 5 to 7 down to a 0
Yeah.
with the brain fog. The fatigue was a 5 to a 7. 7 the worst days, 5, which is still bad, but it's
Mhm.
not the worst. I mean, it was, on certain days, it was less than the 7 of severity. It was a 5, which is kind of able to deal with that. But And so what is your fatigue now?
I'm functioning very well.
Mhm.
Functioning very well.
So would we say fatigue, if we could rate it from 0 to 10?
A 0.
0. And your sleep now at night, because that was part of a problem, was waking up at night. And now?
I had 6 to 8 hours of sleep a night.
Okay, excellent. And your depression?
Has lifted. I just feel great. I feel like I have forgiven some people close to me that I've been having a lot of bitterness against, and it was very freeing to me. And I found myself in the airport, and normally I would carry myself with my head down, and I found myself holding my head up, walking through the airport, and just feeling content and satisfied with myself as a person, and really just content.
That's excellent. That's awesome. So you're
It was,
happy.
that's yeah.
Yeah, so that's a first in how many years for you to, I mean, in all these years now that you said about 14, 15 years, is that the first time
And
you've
I would
actually-
say probably longer than that.
Mm.
I mean, I don't think that I think I always walked around with my head down.
Even since like being a child or
Yeah.
high school kind of years? or
Yeah.
something? Yeah.
I had very critical parenting.
Mhm.
And so, yeah, I think I walked around with my head down. So when I was walking through the airport, I was like, my head's up. It felt different. It felt really good.
Awesome, exciting. That's great.
Mhm.
And so what we did with you, there were some emotional, let's say, repairing strategies that we did in that first round with you,
Mhm.
as well as the remedies to remove certain infections, which we found in your stem cells, and we found in your spinal cord, and in the parathyroid, and in the stomach, and the small intestine, and so on. We found certain infections that were in your tissues that we remedied out of there. and you're functioning a lot better now, yeah?
Yes,
Yeah? Pretty pleased?
I am very happy.
Is this something that you think, referring somebody else in, that you think it's wise for somebody else to get
Oh,
involved in a program
definitely.
like this? Yeah?
Mhm.
Even if you have to come from across the country?
Exactly.
Exactly.
And it's a joy to come from Wisconsin to Florida in
Sure,
January.
that too. Is it, do you think that the protocol was it difficult to follow or simple to follow?
No, it's very simple.
Okay.
I mean, it was better than anything else, any other alternative treatment that I've tried, which I've tried a lot.
Okay. All right. Thank you for sharing with everyone. You can call our clinic at 954-370-3100. You may be able to get into this program with me. I can help you recover. Speed of recovery varies from one person to another and from one condition to another. So you've got to understand that before you try to contact our clinic. I'll put my clinic assistant's email address at the bottom of the screen. So whether you call or email to try to get an appointment here, and let's get on the journey to help you get well. Depression, fatigue, brain fog, you don't have to suffer from them anymore. It's not about the vitamins. It's not just about taking certain dietary changes and nutrients that you've got to take. We've got to find the causes of your individual condition, you as an individual, and help you get well. And that's the only way to do it. If you don't know what causes your condition, you can't really truly overcome the condition. We've got to know what causes it, treat the causes to relieve the condition. Pretty fair. Thank you for coming on and sharing this with everyone.
Thank you.
Okay.